I am often asked about what the difference between Botox and fillers are, and it's interesting to talk about that because they do completely different things. And when I talk about Botox, what we're using is a toxin that will paralyze or weaken muscles, and that can be used to simply prevent the formation of lines, or it can be used aesthetically to alter brow position. And in terms of volume and fillers, that's a completely different issue. What we are doing there is restoring what you've lost or enhancing what you have. And they are functioning completely differently. There are regions that we fill, and there are regions that we Botox. And conversely, there's regions that we will not Botox, but we love to fill. So I'm just going to go through that right now. And in terms of the regions that we Botox, words that we use is glabella, which is the area between the eyebrows. So frown like you're mad. So this can be made perfectly smooth with just Botox. If, when you are at rest, unlike Stephanie who's nice and smooth, you have 11s in place, that may need a little filler to restore that volume, and then paralyze that with the Botox. Raise up those brows, and she doesn't even form lines at rest, so that's the beauty of youth. And so if we form transverse lines across the forehead, Botox is able to make that forehead look nice and smooth. This is an area that we call the crow's feet. Smile big, and again, hardly has any of those. So Botox can be placed in this area here, smoothing the lines at rest, but as we age, the tail of our brow comes down. So paralyzing this muscle can actually cause an elevation of the brow, which is really very nice, and get those eyes open. As we move down around the mouth, Botox can be used. It has to be used very, very carefully. One of my favorite areas to use it is in the chin. When we contract that chin, can you show what that looks like? We create, yep, there you go, a little orange peel, and it deepens what is called the labiomental sulcus. And if we put Botox in the chin, it keeps that nice and smooth. It improves the appearance of this area, the pre-jowl area, and it makes this crease less deep. If we are developing little radial lines that come from the lip as we age, Botox can be put at the lip lines to just keep you from pursing quite so strongly and help sort of stave off the development of those lines as well. In select patients, the depressor muscle of the corner of the mouth can pull down that corner, and occasionally we will put Botox into this area. One of the things that she's demonstrating right now is a classic smile line, and I will get people ask me, hey, can you take care of that with Botox? Absolutely not. When you put Botox in this area to work on the elevators of the corner of the mouth, you may make this nice and smooth, but it will disrupt and alter your smile, and you will not like it. Fillers are basically used to replace volume. They don't alter the function of muscles, and they just restore a more youthful contour to the face. Typically, what we see as we age are loss of volume in the temporal area, and we start to see a little descent of the brow. You can lose volume beneath the brow. Right? This is amenable to really nice contouring with a hyaluronic acid product. Cheek volume is lost in the area of the cheekbone and under. As we lose this volume, we see that the nasolabial fold starts to look deeper. This is the nasolabial fold, and it looks as if the cheek is falling forward and down. We also start to see the marionette area start to look again as this area on this side is full. This is thinned, and the nasolabial fold, which typically ends in youth above the corner of the mouth, now is extending below the corner of the mouth. Lastly, here what we see is the point between the chin, which keeps its fullness. We start to lose volume in this area here, and we start to see descent of this fat pad, creating a jowl. And so volume can easily be added into what is the pre-jowl sulcus, the marionette area, nasolabial folds, cheek, malar and submalar area, and temporal area.